Hi guys, right. Okay, so this is your scope of practice assessment. It's an online assessment and it's super straightforward. I'm going to show you here how to do the assessment. I'm also then going to do the little bit of teaching resources in the next video. So the assessment is called scope of practice. And I know with you particular guys, it's under week 6, 7, 8 here. This one here. Oh, it didn't change. Okay, so really this is the 18th. Okay, this is the 18th. Right, here is the assessment. I'm going to go through it with you now, but also what it will be good that to stop and to read first is some of these links. Okay, there are links to job descriptions, professionals, and so forth like that, which will help answer this question. And also I'm going to do a voiceover over the PowerPoint afterwards. Okay, let's click into here. Hope you all know where we're going together. Now, I've done a Word doc template to help answer the questions. Now, the Word doc template that you can open here has exactly the same as this: name, introduction, what it is, and you type it in. So I'm going to click on this, but I know it's going to open down here, like in another page, and it will do for you too. Just open it and show you. Okay, so this is basically a template. This in bold, keep your headings and delete the ones that are here in italic. So read it first, delete, and type in your answer. But I've got more knowledge to help you answer this question. So in the introduction, you're going to put in here, what does the scope of practice mean? And what is your essay going to explain? Now I'm just going to shrink this because this is where you're going to put in all your answers. Look at this. There's links to every one to help you answer each heading. So what does scope of practice mean? Click the link or copy into your search bar. So if the link doesn't work, please highlight it and copy it into a new search bar. But it should work. Cross fingers, cross fingers. Here we go, scope of practice. So remember, you have to put this in your own words. It's no plagiarism allowed, but this is a fantastic website that you can get all the information you need. It's all to do with healthcare directed as well. So scope of practice is the limit of your knowledge, skills, experience that have made up the activities you can carry out within your professional role. Keep on reading, keep on reading, keep on reading. And also as well, go on to your own. I'm going to click, can you see at the top another tab? And I would write into Google, what is scope of practice? So I'm doing two different types. Oh, look at this. Mercy Hospital in Dunedin, which is also a New Zealand website, is giving me another description, the boundaries in which the healthcare provider may practice. So here's to start your essay introduction is you've got two resources. You can do two references. Okay, we go back to where we are, go back to Moodle, and you can start answering this question here. Introduction. What does the scope of practice mean? And what are you going to start explaining throughout this whole essay? And you see that as we go there. Right, so you delete this bit here. Type in, what does scope of practice mean and what is this essay going to explain? Now, what this essay is going to explain is all about multidisciplinary teams and how they have different scopes of practice, and you're going to do some examples. So this would only be a small paragraph. Okay, your next heading, what is the multidisciplinary team within a healthcare system? So first of all, let me know what the word multi is. I want you to Google the word disciplinary is and team. So just break that down so you really understand it. That's literally one sentence. Multidisciplinary team within healthcare. So that is where one person may have complex needs and they need more than one professional. Now you've got lots of examples. I'm just going to shrink this. I'm going to go back to our Moodle page. Why did it do that? Tracy, you're a silly goose. I'll make sure it doesn't. Bear with. This might happen to you sometimes as well. I'm going all the way down to scope of practice, which is week. It's actually week 9 and 10, isn't it? Open up my assessment again. All right, here we go. Break down the word, like I said, for the next question. I've put a link here you can use, so use this one as well. You might want to copy and put that in the search bar for a second explanation. So don't always just use what I've got here, but they are quite here we go. So it tells you here what a multidisciplinary team is here, why we have one, short terminology for it here, what is the reason of having it. Okay, so it's just to get the best outcome for the client. So have a good read. Please watch this YouTube clip. All right, so once you've had a good look at that, you can start now going on to here. Right, what does it mean? So you've broken down the word, and now you're going to start typing in what it actually means and how it gets the best outcome for the person, because they need to have more than one healthcare professional. Neat. How does a multidisciplinary team work collaboratively together to support the client with complex needs? So here you want to describe 3 professions and how they have to work together to support a client. Now, you can make up 3 conditions, or you could look at your own client. The best thing to do is to make up your conditions, and I'll have to make sure I get these settings right so it always takes you back to the Moodle page. Sorry, guys. Something on my to-do list again. Duh. Otherwise, you'll get sick of this too. Right. Here we go. Open it up again. Sorry. Okay. You tell me what a multidisciplinary team is and what does it mean. How does a multidisciplinary work collaborative support climate complex needs? Now, there's 3 different links here, 2 jobs, and then 1 talking about multidisciplinary team care. Okay, let's say as somebody that has had an accident and have broken their legs. Let's pretend, I don't know, you can say whatever you want. A particular person then has not only do they need a physio to help the rehab their muscles to get better, and you're going to describe what the physio does, and you're going to describe their role and their scope of practice. And then also you might describe, right, well, now he has not use of his legs for a short time. The occupational therapist is a person that comes in and redesigns the house, the home, the area, so that person can live the best quality of life while the person also has physio trying to get their person's legs better. So there are 2 professionals there that have a completely different scope of practice that are going to do the best outcome for the client that has broken their legs. So have a look at this as well. So how does a multidisciplinary work collaboratively to support the client with the complex needs? Don't go too much in depth, because you also need to do an example here. So you can still do an example here, like I just mentioned, someone that's hurt their legs, they need to have physio, then they need the occupational therapist into their house. And then they may also need to have regular appointments with the doctor, the pain clinic, the orthopedic surgeon to have straightening their legs as well. Here's an example. Think of your client. Now, I know one of you have got a client that has diabetes, high blood pressure, and then you've got another. I know some of you've got clients got a stroke, and they have other conditions as well. Think now, or even start researching what multidisciplinary professionals, what professionals do they have that have to collectively work together to get the best for that client? So someone with diabetes might have a dietitian. They also have leg ulcers. They also have a nurse, a district nurse coming in to help with those leg ulcers. And then whatever other condition they have, they might have to do regular checkups, or it's got yourself. You're also part of this professional organization. As healthcare is coming in to do the mobilizing, the washing, the care. So there's 3 different health professionals have qualifications in different aspects to help go and work to get the best for that client. So what does each one of them do, and how do they work together to get the best for the client? Cool. Describe and explain the importance of scope of practice. So here, just a short paragraph. Have a look in here about work regulations and how it helps you stay in your scope. as a healthcare assistant, we don't have a legislation, but we do have code of rights, which you're going on to next here. All right. But you could go and go, yeah, I'll stitch that up for you, but that's out of your scope of practice. All right. Because you're not trained to do that. You don't have a legislation to help you do that. So have a look about describe and explain the importance of scope of practice within multidisciplinary. Have a look at this link here. Okay. Have a read and just do a short paragraph on this as well. Okay, describe the scope of practice of your role as a support worker within your current environment. How do you know what your scope is? How do you know when you're going too far? What does do you need a qualification? No, you don't. But the person who supervises you should have a qualification. They're the one that train you, so they will keep you in your scope of practice. What legislation is out there that can support you in your role if you need a voice? So here, have a look at these guidelines here. Here's your code of rights. This is for the patient and yourself. Also, your job description is like your contract as well. So that's what you're going to mention. It should have what they require you to do within the nurse home or wherever you may be, should have. And in your training, you should have training manuals, should have. That tells you what you shouldn't do. And that's basically your scope of practice. All right, last one. You're doing well. Describe how this is different to the scope of practice of registered nurse. Okay, have a little read of these. Now, you know yourself, a registered nurse has 3 years, a bachelor degree of 3 years up to level 5, 6, and 7. And then when they are practicing, they still have to keep their license going. Okay, that's the difference. With us, we do not actually have to have any qualification and we can be trained on the job. So these are sort of the differences, but at the end of the day, we're both there to get the best for the client, okay, to get the best health. So describe how this is different to the scope of practice of the registered nurse. That's you. Read the job description. Also describe in a little list what the nurse can do compared to what a HCA can do. So a nurse can do medication independently. We should always be trained or be watched. A nurse can take OBS and maybe even do an IV injections. There's no way we should be doing any of those sort of things. So have a good list in there. I want a nice long list. End with a small conclusion. It's always nice just to say you've understood by researching in this essay that HCA scope of practice is actually quite vulnerable, and you really need to be careful about what you can and can't do and what you can and can't do legally, what legislations help you in that way. You've also got the unions as well. I hope this makes sense. I'm going to now make the scope of practice PowerPoint, and I'll make sure these links open up in separate pages so you don't have to keep clicking back. I also actually have these links separately all down here as well. And scope of practice PowerPoint, this is where I'm going to start doing my voiceover. Okay, hope that's enough gobbledygook for me. And I'll get on to this now. Straightforward, don't overthink it, and have fun doing it. Don't procrastinate.